Desert Oasis Healthcare believes knowledge is power, but the reality is we know that the healthcare world can be intimidating and confusing sometimes. So with these educational and informational videos, we aim to combat misinformation and break down complex health topics. And today we're talking all about HMO versus PPO, and I brought together a panel here of experts. Thank you all. We're going to go down the line for our introductions. We have Guerra, the Employer Group Project Manager, Dr. Brian Hodgkins, the EVP of Clinical Operations at Desert Oasis Healthcare, Melissa Diaz, Director of Member Growth and Retention, and Brian Bilhartz, the CEO of Bilhartz Desert Insurance. And I want to just start, just for everybody to know, and this is important for me, the healthcare world is confusing for everybody. Seasoned doctors themselves, the most educated people. I mean, you've told me this in the past, right? Can you share some of your client stories of confusion?
Yeah, absolutely. I mean, we have doctors, we have executives, we have people from all different, areas of life that come to us just as confused as everybody else, right? So it is a very complex and complicated system, but that's why, you have people like us here on this panel to really simplify it and say things in regular language and terms.
So I don't want anybody to feel intimidated if they're thinking, oh my gosh, this video's for you. That's why we're making it, right? I want to start, Melissa, let's just with the basics. What does HMO mean, PPO mean? Why are there even two different options in the first place?
So basic difference is HMO stands for Health Maintenance Organization, and that's going to be managed care. PPO stands for Preferred Provider Organization, which means it's a network that you have to use, but you don't need to have referrals or even an assigned primary care doctor for that matter. You just need to make sure that you're using the doctors within that network, in that PPO network. So HMO is managed. So you have a primary care doctor, that's your care manager, and they help you decide where you need to go and how to get your care. PPO, you're just kind of left to yourself to figure it out.
So let's say, again, our audience right now, these are people under 65 who are working. Let's say, Megan, somebody's going down an HMO journey. What does that look like? And then let's juxtapose that with somebody going down a PPO journey.
Sure. So with an HMO, you would select a primary care provider, and they are the ones who really help to facilitate your care. In addition, when you select a primary care provider, say with Desert Oasis Healthcare, we become your medical group and you become our member. And then if you need to see, say, a specialist like a cardiologist, a dermatologist, your primary care provider could submit those referrals for you. And then it would come to us to approve them to a contracted specialist. In addition, when you have an HMO with somebody like Desert Oasis Healthcare, we have built a network of specialist providers, classes, services that are available to you as our member.
It's like the quarterback, right? Managing the team for everybody. I want to talk a little bit about accessibility, because I think sometimes people hear the word PPO and they're told, oh, that means more flexibility. But Brian, what does that mean exactly?
Well, I look at both of these terms kind of as in a different way, as we're talking about the complexity at the physician level or the executive level, someone getting into this. Just imagine the patient level, how confusing that can be. And what they hear is PPO, I get access to everyone and anyone. And that's really not true in the first place. You still have to go to their network. You're going to pay more out of pocket. So normally what we see the trend is patients who kind of feel that they can quarterback their own health care, they'll go to PPO. They think they can go to Cedars or UCLA or anywhere they want to go for care. And that's not always true. And in fact, all healthcare is provided locally. What that means is if you're living in Palm Springs and you join an HMO, and I say HMO, that's PPO is like a methodology to pay for care. That's the way I look at it. HMO, I was trained at Kaiser. That's a health maintenance organization. That's a system of care. That's a team-based approach to care that leverages all the experts in one place under one roof to provide your care. So if you like a team-based care, instead of just your doctor, social worker, pharmacist, nurse, all under one roof, that's the HMO strategy. It's normally less out-of-pocket costs for you. And a lot of people make decisions on healthcare based on what they have in their pocketbook. And I think that's a choice when I say locally. That's what's happening all over. So if you're in Palm Springs and you want to join a PPO and think you can go to Eisenhower or go to any expert, guess what? If you're our HMO, part of our network, you can see all the same specialists. In fact, we're competing for the same specialists out here. So it's kind of, you think you're getting better access, but really For Desert Oasis Healthcare, you probably get better access with us for all the specialists who are local.
I'm curious, where does this misinformation come from then? Or this misunderstanding that the community has with HMO having so many limitations?
ChatGPT, AI.
That darn ChatGPT.
Talking to your neighbors and
Yes.
friends who make recommendations about doctors they like. This is a great doctor. And if I could only see that orthopod. If you want your PCP to really know your health and be able to coordinate and connect all the dots so that when you get a CT or an MRI for a back problem, they get those results and they can help get you to the next specialist or to the surgeon. That communication doesn't really happen that well and seamlessly in the PPO world. You have to be the expert on your own health, and you're going to have to advocate for all those decisions and choices that are made.
I think a major benefit of an HMO when you have this team managing your care is reminding you it's time for that mammogram. It's time for XYZ, right? And I know outreach is a big part of what DOHC does.
It's extremely important. And, our wellness clinic is on top of that. We get patients in every year to make sure they get their full tip-to-toe exam. But then we're also sending reminders to get your colonoscopy, to get your mammogram. And you may not know, do I need this every year? Do I need it every 5 years?
Right.
So we're at the top of the forefront of making sure that people, because it's very important. It's important to us to make sure that people are being cared for. So we follow up with sometimes people might get a little annoyed with all the, follow up.
Over-communication is better than
Over-communication,
under-communication.
exactly.
I strongly
But
believe
we're
in that.
making sure you're getting what you need done. We'll drive out to your house and draw your blood. I've seen it happen.
I've seen
so.
it too, yes.
And to note, that's the benefit of an HMO with Desert Oasis Healthcare. With a PPO, you're much more kind of on your own, managing your own care. And when you need to seek out care, it can be very confusing to know, who do I need to see? What specialist should I follow up with?
What
Who's
network?
available to see me? And when you have Desert Oasis Healthcare with an HMO, you have a full team behind you, supporting you and guiding you in your care.
And again, we're talking, this group that is still working in the community. These are moms with multiple kids. You're driving to and from practice, all the things, right? You need that reminder for your health care.
Definitely.
We often think of ourselves last, especially as moms, yes?
Yes, and it's so great to have somebody reminding you, like, it's time for your mammogram, it's time for your colonoscopy, and these are potentially life-saving screenings that people need to have. And having that reminder and that team behind you that cares means the world.
And at the end of the day, when we talk about managing your care, calling, checking in, did you get this mammogram? It's time for this colonoscopy. The whole goal is to keep people well, right?
Absolutely. The most expensive care that you can seek happens in the emergency room and in the hospital. And we treat those as failures on our part. If you had to go to the hospital, not for an accident or something, but something preventable, a diabetic complication, right? Or blood pressure that was out of control and now you had a stroke. We count that as a failure. We didn't do our job right if that's where the care had to be provided. So we do everything we can to make sure you get the right care you need and all the care you need at the right time.
Yeah, I like to refer to managed care as proactive care, whereas non-managed care is more reactive care.
It's a great way to describe it.
And we've all heard early detection. I mean, it's absolutely true. The earlier you find something wrong, a disease, and getting it treated quickly means life or death. So it's extremely important.
Well, to your point of a PCP, a primary care physician, you have one with an HMO. That's not a limitation. That's a benefit, right? Can you talk about that?
I think that's a great benefit. Most people start their healthcare with a primary care doctor.
Yes.
I know I do. I trust my primary care doctor to help me make choices. Give me options, give me choices, make suggestions. I'm still going to make the final determination on where I want to go for help. If you have really bad cancer and we can't help you here in the desert, we send people to UCSD, one of the best cancer centers in the world. We send people to Cedars-Sinai, one of the best tertiary care centers, quaternary care centers in the world. That's our connections, that's our contracts. But we're with you every step of the way. We make the referral, we contact the doctor, we get those really difficult, heavy lift parts of the care plan done for you. You just got to show up for your appointment and we'll handle the rest.
And I think also on the PPO model, what doesn't really get mentioned often is, like Brian said, these patients are having to become their own advocate, which also means they're having to do their own research to find the providers that will accept their coverage. And that could be a very laborious process and aggravating, right? If you have a condition that you need to see someone to get a diagnosis or treatment on, but you don't know who actually accepts your insurance.
So tell us, when somebody wants to see a physician out of network, a specialist out of network, what does that mean when they have an HMO?
So traditionally, out of network is not, it's not allowed. So we have a huge network with Desert Oasis Healthcare, and it's not only Desert Oasis, but our sister groups, Heritage Provider Network.
Yes.
We all share contracts. So if there's not a provider here that patient needs, we're going to find that provider somewhere else in the area and then help the patient get there and get the care that they need. So out of network, if they pick a doctor out of the air that they want to go see that we're not contracted with, they would not technically be able to go see them. But there's very few and far between providers that we do not hold a contract with in the state of California. So
there's not a shortage
Yeah.
there of
Yes,
specialists
correct,
to see,
correct.
right?
yeah, and if we don't have it here, we'll find it and get them there. So
So let's say somebody would benefit from having flexibility of a PPO. Who is that person?
I think that the flexibility would be maybe someone that travels a lot, that's out of the area a lot, that is comfortable managing their care, is comfortable navigating the healthcare system, knowing the amount of work that needs to get put in to be able to find the doctor that you need. All too often, you're given a list of doctors that are contracted with your PPO, and you call 10 doctors, and 8 of them tell you, no, I'm sorry, I'm not contracted anymore. So those systems are not up to date in the health plan organizations. They don't keep those up to date. We've heard a little bit about ghost networks in the news recently, and I can say it's absolutely true. The insurance companies don't want to remove those doctors because they want to make their networks look inflated. So it makes it a big problem for the patients when they're trying to access care on a PPO. Where with Desert Oasis, we have our providers, we have our network, we authorize the referral, they get their appointment, and they go. No legwork has to be done on their end.
Brian, you had mentioned that people often make decisions with their pocketbooks when it comes to their health care. So I'm curious if you could just explain a little bit the cost comparison between HMO and PPO.
A lot of times what you find is that the PPO plans may have lower monthly premiums, and I think that's what is attractive to a lot of the employers, because they're looking, to them, the healthcare that they offer employees is an expense. So they're looking for the easiest way to lower those expenses. So a lot of times you find premiums are lower on PPOs. However, when you actually access care, you receive, medical services, your out-of-pocket costs are going to be higher on PPO plans than you would find on traditional HMO plans.
So in the big picture, HMO technically would be considered more affordable, yes?
Yes, absolutely.
When it comes to really understanding, more than just a monthly premium, what should people be looking at? It's not just about that number, as Brian was alluding to.
Definitely. So the premium is something that you would want to examine. Obviously, that's what most people look at, what comes out of their check, essentially. But then you have to look at the costs of copays. So when you actually go to seek care at your doctor, at a specialist, at an urgent care, what is that amount that you're going to be paying out of pocket? Additionally, there are deductibles that you should look at, meaning how much you're going to pay to seek out care as well, versus what the insurance is going to cover. And so you should definitely look at those and see what fits best for you.
I want to talk about what lower cost really means when it comes to lower care. I'd like to think of myself as an objective third party here. And I truly feel the love from doctors and specialists and physicians at Desert Oasis Healthcare. And I see, it's part of my job to interview people who have wonderful experiences here, and they just speak from the heart, and it just oozes out of them how much Desert Oasis makes them feel seen and heard. So I would just love to hear from you, Brian, to explain that lower cost does not mean lower quality of care by any stretch of the imagination.
No, absolutely not. And one thing I'm very proud about this organization, you wouldn't believe how many people we help who don't have our insurance at all, who are looking for answers.
So true.
Their neighbors are concerned about someone in the community, and they just naturally pick up the phone and call us, and they ask for help. And I can tell you, Melissa spends a lot of time getting members, our community, our neighbors who don't use our insurance, aren't part of our group, the health care they need. So we step up when you don't have our insurance. We'll find you who can provide the care and at a cost you can afford. No, quality is not defined just in how much you're paying for something of value. This is your health. There's no greater asset in your family than your health, everyone's health. Because when things get expensive is when people are unhealthy. They can't work, can't pay the bills. They're in the doctor's office every day. They can't even get to us sometimes. We spend a lot of time creating a network and a safety net to get patients to where they can get care anywhere they're at when they need it. And that doesn't happen in the PPO world.
You can't put a price on that, right?
Amen. It gives me chills just talking about that. Given your medical background, of course, can you talk about how having an HMO leads to better outcomes, medically speaking?
The data on this is only controversial when you're talking to people who are really sold on Medicare fee-for-service, but the evidence is in. And this is just a teaser. Our own government, if they had a choice, would say Medicare Advantage for all. Not Medicare for all, Medicare Advantage for all. And because the outcomes are pretty clear. You get better health, longevity, you live well longer, and you don't have to spend a fortune to get it. And the reality is less money is spent on Medicare Advantage patients, the HMO side of Medicare, than on Medicare fee-for-service. Yeah. There's just no one watching where those patients go and how much fragmented care there is and redundant care. In our network, we pride ourselves on you only see one doctor one time, and we'll try to get it right the first time.
And everyone's talking to each other because it truly is managed care, right? It's all coordinated. And just to truly underscore that concept that with an HMO like Desert Oasis Healthcare, you have this primary care physician, this quarterback, essentially keeping, I don't know all the right football terminology, but what they're keeping score, they're keeping track, they're doing all the football things they need to be doing to really manage all the different lanes that you're in. So I would imagine as, in whatever age you are, you just need that help from those experts, right? From that primary care physician leading the charge.
Yes. And you're not left to have to do that, or it's not left to your family members to have to manage that for you. We work with tons of patients' families, but they're not the ones that the burden is put on. We accept that burden and we, organize the care. The family can then be the support for the patient, and that's really what they need.
Definitely. I'd like to just end going down the line with each of you sharing the biggest takeaway for audiences from HMO versus PPO. If they could take one thing away from watching this informational video, what would it be?
I think mine would be to look at where we're located and the services available in this area, because we are a little bit different here in the Coachella Valley and surrounding areas. And an HMO is actually an amazing option for people here in the Valley. We are 5-star for access at Desert Oasis Healthcare, meaning you can get in to see who you need to see when you need care. All the amazing benefits and added services that we have created for our members. So even if the costs up front may look a little bit higher at times for an HMO, when you actually need to seek care, it's probably going to be lower over time and most likely a really great option for most people.
Melissa told me something once that stuck with me, and I mention it whenever I can in the community. And that is, the greatest compliment you could give to a healthcare organization is that you would recommend your parents get care there. Yes. And I have, and I do. And I don't take that lightly. If I didn't think we provided the best care, I wouldn't be sending my mom here or my neighbor's mom here. And a lot of companies in healthcare say they can do that. That's what they do. We live and breathe it every day. There's pride in our effort. And we've been here for 45 years. And I can tell you, I don't think we're going anywhere.
No.
So
we're just getting started,
just
in this community.
I've worked for Desert Oasis for 17 years, and for me, the ability to help people one person at a time, hearing that gratitude and the thank yous, and knowing that they're going to get better, they're going to feel better, knowing the burden has been taken off them, the stress, that to me is why I do this job. I couldn't be prouder to work for a company than I am for Desert Oasis Healthcare.
So sweet.
Yeah.
I think don't believe in the hype of PPO. And also don't underestimate this organization.
Yeah.
And we talked a lot about providers and networks, but also the programming, the other services that Desert Oasis offers are so critical to patient care, to patient longevity, living their absolute healthiest life possible. So Don't underestimate it, and you should try it.
Yes, thank you all. And I appreciate everybody watching. I encourage everybody, if you need to play this video again, please do. Send it to a neighbor. As we said, a lot of people sometimes have a misunderstanding, and it's not their fault, right? That's how information sometimes breeds out there. So you could also always reach out. We're going to have the information on the screen, but of course it's mydohc.com. If employer groups want to get a hold of you, tell us your contact.
Yes, Megan Guerra. It's mguerra@mydohc.com. And you can always reach out to me, 760-200-6793.
And Brian, we of course say always go local. Reach out to our local agents. Tell us how to get a hold of you.
Yes, our office number is 760-848-7171.
Perfect. Thank you all for participating and being a part of it, and we appreciate you watching.